In this video, I want to help you understand when you can drive, or maybe when you can't drive, after a knee injury. I'm Dr. David Geyer, orthopedic surgeon, sports medicine specialist. I provide athletes and active people ways to feel and perform your best regardless of age or injuries. Now, as I've talked about with shoulder injuries, I've talked about with foot and ankle injuries, knowing when it's safe to drive can be really tricky. Knee injuries are no different. Again, you don't want to depend on other people to get to school or get to work or just do what you want to do, but you've got to be safe about it. And unlike foot and ankle injuries where you may be in a cast or you may be in a boot, here you don't have anything on your foot. And again, in theory, you should be able to push the gas and then move it quickly over to the brake. But there's some simple things to think about. As always, talk to your doctor about your specific injury or specific surgery to know if you are supposed to be driving soon after that injury or surgery. But here's some things to think about. Again, you don't have a cast or a boot, but you may have a brace. Now generally like a knee sleeve, with the little kneecap cutouts, that's probably not a real big deal and not something that's going to limit you driving. But if you're in a brace that has hinges or something like that, that can be a little more restrictive. So you may want to think about maybe in that scenario, and that's typically right after an injury or maybe in the first few weeks after a surgery, may not be the best idea to drive in it. Now, if your doctor allows you to take that brace off just for short periods of time, then it may be fine. The big thing with knee injuries is either just from the pain of the injury or from the swelling of the injury, your quads shut down. Sometimes a little bit, sometimes a lot, and so your quads are really weak. And the reason that matters is that with that quad weakness, it's actually a lot harder than you think to get from the gas to the brake. You think, I should be able to do that. But like, say, ACL surgery. In the first few days after an ACL surgery, it's hard just to lift your leg off the table or off the bed. There's no way, if you can't do that, that you could actually safely drive, basically getting your foot from the gas to the brake. Now, if it's your left leg, maybe it's not such a big deal. But if it's your right leg, in an automatic car even, that would be hard. If it's your left leg in a manual transmission, again, it's hard because you got to push the clutch. So I think that's what I'd think about. You've got to have the quad strength to very quickly slam on the brakes because you don't want to drive, and it's really not safe to drive with your right foot on the gas and your left foot on the brake. Now, how will you know if you're strong enough to do it? And this really applies to just basic knee scopes, to ACL surgeries, to patellar and quad tendon repairs, fractures around the knee, any kind of thing. Again, talk to your doctor. But the way you can see if you're really ready is basically get out into your neighborhood early in the morning, get into a big store parking lot early in the morning where there's no cars in it, and test it out. Go with somebody else that can get you there, but test it out. Make sure you can slam on the brakes quickly while somebody's there with you before you get out on the busy streets. If this video is helpful, click the video below for much more helpful information. Make sure to subscribe to get tons of information, tons of videos delivered directly to you on sports and exercise injuries, health and wellness. And I look forward to seeing you right here next time.